Anyone with diabetes is at risk of developing diabetic retinopathy. In its early stages, there may be little or no visual symptoms. Without early detection and treatment, diabetic retinopathy can permanently damage the retina. If the condition is not caught early, it may produce symptoms that affect vision. These include mild blurriness in near or distance vision, floaters, and even the sudden loss of vision. If left untreated, it can cause severe vision loss and even blindness. Eye surgeons cannot reverse the damage caused by diabetic retinopathy, but if caught in time, modern treatment options may help slow its progression and prevent further vision loss. It is critical for patients with diabetes to be examined on a regular basis, even if they have not yet noticed any symptoms. If a patient experiences any significant change in their vision, they should contact their doctor for an immediate appointment, even if they recently had an examination. One form of diabetic retinopathy is called proliferative diabetic retinopathy, or PDR. PDR occurs when new and fragile blood vessels grow abnormally from the retina into the vitreous. This can result in bleeding, scarring, and contraction of the vitreous, which may lead to retinal detachment. PDR can cause severe vision problems, and it can even lead to blindness. It must be treated as soon as possible. One form of diabetic retinopathy is called non-proliferative diabetic retinopathy, or NPDR. NPDR occurs when diabetes damages small blood vessels within the retina. These vessels start to leak both fluid and blood, gradually causing the retina to thicken or swell. Over time, the swelling, or edema, thickens the retina, causing the vision to become blurred. Macular edema is a condition that occurs when fluids build up within the macula, the central area of the retina most critical for vision. The buildup of fluid causes the macula to swell, disrupting its normal shape. This results in damage to vision. The symptoms of macular edema include blurred vision, distortion of images, missing areas, or a change of contrast in vision. Left untreated, the swelling can cause these vision problems to progressively worsen. If any of these vision problems occur, speak with an eye care professional immediately. The macula is the area of the retina that is responsible for clear vision. As a person ages, the vitreous inside of the eye begins to shrink. When this occurs in the macular area, the retina initiates a healing response with a migration of cells found within the retina itself. These cells form a thin layer of scar tissue known as a macular pucker or epiretinal membrane. Over the course of an individual's lifetime, the vitreous inside of the eye shrinks. As it continues to shrink, a portion of retinal tissue may stay attached to the vitreous, leading to a retinal tear. Left untreated, a tear may lead to retinal detachment. With treatment, the damage usually can be repaired. Over the course of an individual's lifetime, the vitreous inside of the eye shrinks. As it continues to shrink, a small portion of retinal tissue may be torn off of the retina, leading to a retinal hole. If left untreated, most retinal holes will not harm your eyesight, but in some cases they can lead to a serious condition called retinal detachment. A retinal detachment occurs when the retina's layers separate. Any portion of the retina that is detached cannot send visual signals to the brain. If left untreated, retinal detachment can cause devastating damage to an individual's vision. Retinal detachment is considered an ocular emergency that requires immediate medical attention.